My name is Dr. Gina Brown. I'm currently serve as the Dean for the College of Nursing and Allied Health Sciences here at Howard University, and I've been here for 7 years, and it has been a whirlwind of experiences and fun and daunting tasks and just all sorts of things in this last 7 years that I've been here, but I wouldn't trade it for the world. I did serve at Washington Adventist for almost 12 years. I started off as a chair for nursing, and in that time I went from the chair of nursing to the dean for the graduate professional studies. I went from that position to becoming the dean for health sciences, profession, and wellness. That was my last position before leaving Washington Adventist University and transitioning to Loma Linda University in California. At Loma Linda, I was actually tasked with being the DNP coordinator in terms of building a program. So they didn't have a DNP program when I got there. I'm happy to say that we had a successful 4 years while I was there. Started out with no students, ended up with a rave review program, which is still in existence today, before being called here to Howard University, where I currently serve. My driver, my premise, my goal in life is to really make sure that I can educate as many students of the diaspora anywhere. The tie-in has been to ensure that not are we just educating students here at Howard in our various health professions. We don't have just nursing and health professions, science and wellness. My goal as the Chief Academic Officer for the College of Nursing and Allied Health Sciences has been to educate our students that are here on the ground so that they can go out and serve globally. So it's not enough for them to be here in the nation's capital as students of the Mecca, because Howard is #1 in everything we do. That's not enough. What they have to learn is how to go out and serve in areas that are not as experienced, that do not have the wealth and the premise and the background as that we have here at Howard. And to learn how to use less than the resources we have now, and to be able to serve students and faculty and staff and people all around the world. That's the difference in what it is I think I can do as a practitioner here at Howard. My goal as the Chief Academic Officer for the College of Nursing and Allied Health Sciences is to make sure that we are #1 in terms of what it is we do, to make sure that our educational goals and practices are that which meet industry standards, that our educational components of what it is we're teaching our students is second to none, to ensure that our current structure of classes has the appropriate validity, reliability, that we're efficient, that we're effective, but that our students are cutting edge. My current thought process model is to really ensure that if I'm the patient, I want to have a Howard grad at my bedside. The only way for me to ensure that the Howard grad is the best person to be at my bedside is to ensure that the care that they're giving is excellent care. And we have to do that by staying relevant, by ensuring that we're ahead of global trends, and to make sure that our students have the integrity that they need to have in order to be able to wear those Howard uniforms. I tell our students at graduation every year, you're walking across the stage. You're going to now be alumni. We need you as alum to give back. The same way it was given to you, we need you to give back. So our alum, while they may give back fiscally, financially, we want them to give back in ensuring that our students have practical places to practice. Because one of the most important things in all of our disciplines is to ensure that our students have practice fields. It's imperative that our alum give back through experiences of allowing mentoring students, allowing nurses to walk with them and shadow them in clinical settings, allowing therapists to work with them in clinical settings. Those are the most important give backs that our alums can do. Serving on the Board of Commissioners for NONAC has really been a fantastic experience, because it's allowed me to see what other schools are doing, what other colleges are doing, what's relevant, what's cutting edge, what practices we need to embody, and what practices we need to stay away from, because everything is not good. And so humbly being able to serve in that position has really been quite an experience with other nurse leaders from all around the United States, to really learn what's cutting edge and what we need to be doing as a discipline. Well, there's a difference between a leader and a boss. A boss tells you what to do, a leader shows you what to do. I hope that my team feels that she doesn't just tell us what to do, she demonstrates by example. She leads by example in terms of what it is that needs to be done. And so I try not to be a boss, I try to be a leader. There is a difference, and I try to make sure I exemplify by example what I want someone else to do. I used to tell my kids, if they run 1 mile, you run 2. If they read 1 book, you read 2. If they run a half a marathon, you run a full marathon, because you're Black. And sometimes you have to do over and above just based on the melanin in your skin. We have to prove over and over and over again some things that my other colleagues don't have to prove. And it's unfortunate, but you have to make sure that you sharpen yourself. You also have to align yourself with other people who believe in who you are. It's imperative. No man's an island. Every single person, myself, others, have been mentored by someone. I think about very warmly my mentor, Dr. Bernadine Lacey, and how much she poured into me as a nursing leader. I think about other people who poured into me as leaders. So it wouldn't be fair for me to have all of that poured into me and not share with other people and mentor them to ensure that they have what they need in order to become leaders. We have to make sure that we mentor at every level. We're mentoring our students, we're mentoring our faculty, we're mentoring our staff. The mark of a great leader is to ensure that there is a plan for succession, to make sure that you're preparing people constantly for succession at every level, building leaders from the ground up, building leaders through every discipline, building leaders through every component of what the student is actually doing, ensuring that there's integrity, ensuring that our students don't lie, that they don't cheat, that they don't steal, that they don't kill, because we have to make sure that we build leadership. And so one of those primary components is to make sure we train our students from the ground up. Nurses can't stop being nurses if we have global tragedy. Radiation therapists can't stop treating cancer patients if we have a global tragedy. Occupational therapists can't stop treating patients. Physical therapists, physician assistants, nutritional scientists. People get sick every day whether there's a global crisis or not. So we don't have the flexibility or the liberty to say we're not going to work anymore. We have to train our students that in every instance, in every facet of life, they are still ready to go. That we leave a legacy with each of our programs and with each of our students to make sure that they, again, are #1. We want to make sure that our students, again, can work at Howard University Hospital, they can work at Johns Hopkins, they can work anywhere in the world, and they're still relevant and know what they're doing. Don't allow people's limitations to be your limitations. If somebody says to me, you can't, then I push to make sure that I can. If someone says to me, that's not possible, I push to ensure that it is possible. There's no limit. You can do whatever it is you want to do. Kamala Harris has proven that. So many other people have proven that. You can do whatever it is you set your mind to doing. You may not do it here. You may not do it in this setting. You may do it somewhere else. But I would say don't allow man's limitations to be your limitations. Pray, focus on the goals, find out what it is you need to do in order to reach those goals. You may have to step back in order to move forward, but don't allow someone else's no to be your no. My legacy would be to ensure that she poured into her students, she poured into her faculty, she poured into her staff. She did what she needed to do in order to make sure that every Howard student that she touched made it through and that they became a Howard alum. That would be my legacy. I would say to the next set of leaders, ensure that everything you do has integrity. Ensure that everything you do has an ethical background and value to it. Ensure that there's accountability for everything that you actually do. Ensure that there's appropriate communication to everyone that you're accountable to and that you're looking to. And ensure that you lead with empathy, making sure that you walk that mile in someone else's shoes before you make that decision.